This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care allows me to embrace my freedom as a physician and entrepreneur. I am Dr. Medina, owner and founder of Luminous Health and Wellness, and this is my DPC story.
Dr. Diana Medina Galvan was born in New Jersey and grew up in New Mexico. She is a graduate of New Mexico State University and obtained her medical degree from Universidad Iberoamericana in Santo Domingo, Dominican Republic in 2008. Her residency was completed in 2013 at Houston Methodist in Houston, Texas, which is affiliated with Cornell University. Dr. Medina Galvan has over 10 years of experience as a family physician with special interests in obesity medicine and hormone replacement therapy. She is currently an active member of the Texas Medical Association and Harris County Medical Society. She served as president of the East Branch of the Harris Medical Society in 2018. Dr. Medina Galvan believes that everyone should have access to affordable, transparent, high-quality medical care. She is well equipped to treat patients with her experience and the empathy they deserve. Welcome to the podcast, Dr. Medina.
Thank you so much, Dr. Concepcion. It's such an honor to be here. It's my pleasure.
I know we've been talking about getting you on the air for months, and so I'm so excited that we're finally here at this moment so you get the whole platform to share your story, and what a story it is. Can you start us off with sharing the beautiful story that goes with your logo and the name of your clinic? Because it has such a wonderful story behind it. And for those of you who have not heard the story before, one, Dr. Medina is going to share it, but also she has it featured on her website. So you can also see who she will be talking about.
So I decided to name it Luminous just because when I would have certain difficult patient encounters in the prior practice I was working at, my patients would tell me, I had one patient tell me that I was like a breath of fresh air. I had another one tell me that I was like a beacon of light in darkness. And so that really stuck with me. And I knew that one day I would open my own clinic and I wanted to name it something of that sort. So I like the name Luminous and I added health and wellness. The story behind my logo is pretty interesting. So when I was a resident, I almost quit. I was second year, I almost quit residency because I couldn't take it anymore. At that time, my Aunt Minerva, who was like a second mother to me, was in the hospital and she was very sick. And just to backtrack a little, when I was a child, she took care of myself and all my other first cousins. We're a total of about 40 because my father came from a large family, total of 14 siblings. So my tía Minera took care of a lot of us, and I was one of them. And for those of you that know me, know that I'm a piece of work. And as a child, it wasn't any different. And so things would break and they would ask, who did it? And they would always say, Diana did it. And my aunt would come to me, and she was like a whole 4'10". She maybe weighed 90, 100 pounds maximum, dripping wet. And she would say, "Did you break that?" And I would look at her in the eye, and I would say, "No, Tia, I didn't break that." And she would tell me, "I see a little horsey on your eyes." So I would run to the bathroom to look at the horsey, and the horsey was never there, right? And I would give myself away unknowingly as a child because I would go run and look for the horse. So back when I was a resident, she was admitted, she got very sick. And I see her and I tell her, "Tia, I'm having a really hard time. I think I'm just going to quit." And she gets very close to my face, maybe an inch from my face. And she says, "I see a little horse." And so, of course, I immediately started sobbing. I don't know what to do. And basically her words were, "You've swam in deep waters to come drown at the shore. Like, you can do this. We don't give up, Mija." And so when she told me that, it was exactly what I needed to hear to keep on going. And so I didn't give up. And she loves butterflies. She loved them so much that my logo is actually butterfly shape, but it's actually two faces looking at each other, and it's her looking at myself. And the colors that I chose were colors of the ocean, because whenever I've made big decisions in my life, I would go to the ocean to just meditate. And so that's how my logo came about. And that's why I named Luminous Health and Wellness.
What a gift she has continued to leave with you and your patients and your family going forward. And, when we talk about family, I want to just point out that Dina has just given birth and welcomed another baby girl to the family. So she's such a champ. I could not be in your shoes doing what you're doing right now, because I would be passed out asleep with a newborn. So it is so awesome that she made such an impact on your life, and that you continue to be a physician and celebrate her presence and her gift to you every day with your logo.
Thank you. The other thing is, I was so used to being in a traditional fee-for-service practice that at one point I was scared to leave. I was like, how am I going to figure everything out? And so the thing is, butterflies, they start off as caterpillars and eventually end up as beautiful butterflies. And then they start flying around. And so that it was like such a symbolic meaning behind using the butterfly as my logo also, because I've evolved so much as a person, as a physician, as a mother, as a wife, just being a business owner.
So when you mention fee-for-service and this metamorphosis that you've gone through personally, I want to go back to your time in fee-for-service, because if I'm not mistaken, you were in fee-for-service for 5 years before you opened your DPC. Is that correct?
So I did fee-for-service for 5 years, and then I did 3 years of urgent care. And during that time that I was doing urgent care, I opened my DPC practice. And then eventually I stopped doing urgent care and just dedicating myself to my practice.
So let me ask you there, when you went from 5 years of fee-for-service into urgent care, what was the reason you chose urgent care versus doing something else, or even leaving medicine at that point?
That's an interesting question. I thought that it was that I didn't like primary care, and maybe that I went into the wrong residency. And so I had a lot of doubt about my future and what I was doing. And so I had a very good friend of mine, actually my residency best friend, who was working doing urgent care. And she was like, "I love this. You're done with the shift. You don't have to worry about anything. You don't take charts home." And that was very appealing to me, because one of the things that I loathed was taking work home. And even though I was physically present in my home, I was not, it was like I was absent. And so I said, okay, let's do urgent care. And urgent care was okay. But when you work for a big corporation, there's a lot of things out of your control. And so then that got old really quick. And that's why I was like, okay, I can't do this anymore.
And when you shared about opening your DPC while you were still in urgent care, how did that transpire?
Everyone's like, okay, good luck. I've never heard of this model. Like, yay, good for you. And I was like, okay, good for me. And I just kept working on it. And little by little, I started getting I guess, getting more vision and getting more support, not only from my family, from my husband, but also from other DPC mentors and friends that have already been there, done that type of thing.
And in terms of when along that 3-year journey in urgent care, when you started your DPC, at what point during that time, or had it been even before you started urgent care, did you learn about DPC?
So I learned about DPC actually by going on a Facebook rant. But the story behind that is I was very pregnant with my first child and I was getting dizzy. And so I didn't want to doctor myself, and I didn't want to see the physician owner of that practice or, the PA in there. And they're very capable, but I wanted to keep my business separate. So my deductible at that time was $4,000. And I enrolled myself as a patient in one of a very well-known clinic. It's one of the biggest ACOs in the Houston area. And of course, when I go there, I don't tell them that I'm a physician. I just kind of lay low, and they do this workup on me. The physician was there less than 10 minutes. Next thing you know, I get a huge bill in terms of labs. And so when I call them and I say, these labs are not that expensive, why am I being charged over $1,000 for these labs? That's when I learned, because I never had experience as a patient, because I just never went to a doctor in the past. And they were like, well, that's the rate you get charged because of the insurance that you have, right? And that's the contract between LabCorp and your insurance. And I said, well, is there any way I can pay cash? Because I know the cash prices are much cheaper. And that wasn't an option. So I was so aggravated with the whole thing. I go off on Facebook, and I usually tell people my Facebook, I express a lot of my feelings. So you can either block me or keep scrolling, and I don't even get hurt. And somebody told me about DPC. And so then I said, oh, that's interesting. And then I started reading. And the more I read, the more I fell in love with the idea. I started off by reading Dr. Ferrego's book. And then I read Dr. Gunther's book, and then Dr. Thomas's book. But I became a member of the DPC private physician group, and I was just lurking. And what I did is, at that time when I joined, which was, I don't know, maybe 2016 or even earlier, what I did was I went through every single post that was posted by physicians. I took a notebook and I just started writing questions and answers of things that were relevant to me. And then I was just up to date with everything. So I had it kind of like a plan of like what I should be doing prior to opening my own practice.
When you had that notebook going, what were some of the major categories that you organized your notes under?
I didn't have any organization. I just kind of went, I'm being honest, I just didn't. And I was just going through each post and just writing down what needs to be done. And then I just kind of, after that, went through the notebook, highlighted things that I should get done first. And then I just took it step by step. I made a lot of errors. Everyone in the DPC group said, keep it small, keep it small. But in my brain, it was like, go big or go home. And I did the total opposite. So I got a very big loan, huge loan, worth more than my house. It was like $500,000 loan. And I did this build out on this tiny space, and it's beautiful and everything. But I wish I would have listened a little more and started off small. But I mean, I've already cried over that. That's just water under the bridge, and I've learned from it, and it's okay. So ideally, I would have liked to have started small, maybe renting a small space, leasing or subleasing from somebody else that's established in a community, but I didn't go that route.
And in terms of being in the Houston area, did you also get mentorship from other DPC doctors in the Houston area in addition to the DPC presence on Facebook?
Initially, no, because I didn't know that many physicians doing DPC in the Houston area. But then the more involved you become in the group, the more you familiarize yourself with other names in the area. And so I became friends with some of the local DPC doctors that are not very close to where I'm at, because Houston is pretty big. And then we curbside each other. I mean, we're friends. And so then we just bounce ideas off of each other.
That's awesome. And going through the questions going through the posts that you saw on the private DPC docs group, and then meeting and talking with people locally, what were the questions that were unique to Houston and Texas in general that you got answers to because you were talking to other Texan physicians?
One of the major things is pricing and how you should structure your clinic. And so what I've learned is that not every DPC practice is the same. And you don't have to do what traditionally has been done in DPC. And what I mean by that, I am not available 24/7. I used to be available 24/7 until October 2021, and that changed. I had to do increase in my pricing. So basically what I'm trying to say is the pricing depends on geographical location, right? So I will not be able to survive on a $50, $70 a month membership. My prices are a little more comparable to the other doctors in the area. And the most I charge for membership is $135 a month.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. Gotcha. And when you mentioned the loan that you took out, how did you get that loan? Did you shop for different types of loans? What was that process like? I ask this especially for those people who might be interested in looking at loans to open their DPC.
So what I did is I went to a local bank, and they have, a lot of banks usually have physician loan programs. And so what I had to do is show them how much revenue I made for that first office. And so I had all those financials. And so they basically did a credit check and they did a whole number of other things. And basically I got the loan. Initially, I didn't think I was going to use that much. I thought I was going to use maybe a third, but then build out is really expensive. And so I even had to downgrade on a lot of things. And it still was expensive the way it turned out. But I mean, I'm happy. At the end of the day, I'm happy. It's my space. I don't have to worry about moving out, relocating, or anything like that. And I think for me, I told my husband, well, everyone thinks I'm crazy. I'm doing DPC. It's either going to work or it's going to work. We're going to make it work. And so that's been my attitude since the beginning.
I love that. And the lack of scarcity mindset when you talk is really empowering. And it definitely, I feel when somebody is thinking more in a abundance mindset versus a scarcity mindset, the mind tends to think in, okay, I'm working with a level of abundance versus I'm trying to fight my way out of a scarce environment. So I think that's great. And when you have, been in this place of it's going to work or it's going to work early on versus now, what have some of your pivots been to continue on that trajectory of I'm going to make it work or I'm going to make it work?
One of the things was boundaries, right? As a small business owner, especially when you're starting, it's hard to say no to some things. But what I've learned in almost 4 years, so March 18th will be 4 years, is that not all money is good money. And you have to know when to say to a prospective patient, this is not going to work. I don't think I'm a good fit for you. And do not be afraid to say that. And the other thing that I did was, for instance, I would reply right away to messages because I want to show them that I'm available to you. But that's not realistic, because what was happening is, as I started growing and I wasn't responding within the next 5 minutes, and I would take an hour, patients would get so upset, like, oh, what took you so long? And I'm like, well, I got more patients, guy, relax. So I had to pivot a few things. The other thing I had to do is I had to implement an enrollment fee, because initially I didn't have that. And my membership was just $99 a month to month. So what I found myself doing was a lot of work for very little pay. The patients would get their records transferred to my office, and sometimes these records were very extensive, and I would just sit there and read them and then make summaries and put in the EMR. And the patient would come in and get their, moles removed. They would get procedures done because it's included as part of the membership. They would get labs almost at cost. And then after a month, right before that next payment hits, oh, by the way, thank you so much, I'm going to cancel. So I had to learn how to pivot and how to handle these situations, but most importantly, not take it personal, because I gave every single patient that has walked through my door my absolute best.
So when you mentioned services, like these patients would come in and get services, how did you determine that they needed those services before their visit and before they canceled? Was that part of the intake form, or did you do services like procedures, like mole removals, like you mentioned, because that came up during the first visit? How did that work?
So initially, I would have so much time. So sometimes my first patient visit would take anywhere from an hour to 2 hours. They're like, oh, by the way, I have this mole here. Can you remove that? Sure, I can remove it. But what I learned to do is to don't do any procedures that first visit. So again, these are just, growing pains that you have to, be presented with so that you can learn how to modify your business, right? And what I mean about other procedures, I tried so many things to get people in through the door. The one thing I don't recommend is don't spend $40,000 in marketing, which I did the first year, and not one person walked in through the door. And I used a very reputable company. Not one person walked in through the door. Okay. So the other thing is, after the first visit, I would kind of lay outline of the subsequent visits. Okay. So I can't address everything in one visit, especially if the patient hasn't been to a physician in 10 plus years. Like I can't do a whole tune-up, a whole tune-up in an hour, even two, because there's so much going on. So I would have to break down those visits. That's one thing. The other thing I started doing initially, which I no longer do, is because labs were so affordable, I wanted to get people in. Hey, your labs are so cheap. Come on in. Do you know your numbers? That's how I would market it. And people would come in and get their labs done. And if everything was normal, it was great. But then there were a few times labs were very abnormal and the patient didn't want to follow up because they didn't want to join. So that left me in a very particular position, right? Because I have a duty to treat if I see something abnormal, especially if I ordered the labs. But so, like I said, you just learn as you go. Other services that I offer in my clinic include, I do FAA Class 2 and Class 3 physicals. I also do hormone replacement therapy. I do aesthetics and weight loss as well.
I want to take a step back because you mentioned how you marketed specifically about labs and come get your labs done. Do you know what your numbers are? When you talked about your opening budget, did you spend some of that opening budget on marketing? And if so, what specific marketing strategies did you employ?
So the first year, as I told you before, I spent about $40,000 in marketing, and not one person walked in through my door. And basically this company not only did my website, but also would write blogs for me and would also manage social media. They would manage Twitter, Facebook, not Instagram, and LinkedIn. The thing that I found is that it was so generic that I don't think it got any traction. So that was the big thing. The other thing was these blogs that they would write, I would reread them, and some of them wouldn't even make sense. So it was like if they had, a bot writing these blogs, not an actual person. And so then I just became very unhappy and I said, I can't go on with this. They also were in charge of my website. So if I needed any type of modification to my website, I would have to go through them. And that to me was just, I was like, this is unacceptable. And so that's when I decided to, cut ties with them. What I have found that works really well, and I think other physicians have said the same thing, is word of mouth. And I tell my patients, if you're that happy with the level of service that I've provided you, please leave me a Google review. Please share it on your local mom Facebook groups, share it on your neighborhood pages. Also is social media, just getting in front of a camera, which I was deathly afraid of. And the way I decided to finally do this was because my sister at that time, who's now in med school, she's at Texas Tech, would always record me. And when we'd come home, she would just watch these videos and just laugh. And I'm like, what's so funny? And she's like, you're funny, dude. You're funny. You should go on the camera. And I'm like, no, I'm not going to do it. And because of my own complexes as a woman, I didn't want to go on the camera. And then one day I said, you know what, I'll give it a shot. So I started doing reels on social media, specifically on Instagram. And then I was getting engagement from people that I never knew. And I didn't realize how many people I was reaching. And so yeah, that helped me overcome that. But that has been the best thing because I did have a non-compete with my first job. And even though it's in the Houston area, 10 miles is a pretty big radius, right? Especially when there's so much traffic. And I had patients that found me on TikTok or even found me on Instagram doing a dance or doing something that were my former patients at my old practice. So that has worked for me the best.
I'm glad you mentioned the dancing, because if you weren't, I was going to definitely mention that. You should definitely check out Deanna's reels, because you find yourself dancing with her. So they're pretty awesome. You mentioned the non-compete. And so I want to ask there, was there anything else in your contract that was at that job that you were grateful to get out of once you left?
Oh, yes. So when I was at that job, my office was towards the front. And so I would see and I would hear the interaction that the front desk would have with the patient. And so it quickly became apparent to me that if you have a very bad front desk person, that can really ruin your clinic, your business. And so the other thing is that my boss, who was an excellent boss, his office was all the way at the back. And so he was completely unaware of what was going on, but I would hear every conversation. So I made sure that in my office is towards the front. It's right next to the lobby. So I hear everything and I'm able to see things through cameras. What else did I learn? Oh, and let me give you another example. Sometimes my clinic would start at 8 a.m, but then the manager would show up a little late. And because of that, then the front desk would show up a little late because it was a friendly environment. But the thing is, just showing up those 10 minutes late is going to throw off my whole schedule, because then by the time they triage the patients, they get their insurance information and all that stuff. So I had to have a talk with my boss at that time and say, hey, if the manager is leading by example and not being here on time, and I'm starting off late, that's why everything is so relaxed. So that didn't go too well with the staff. I mean, they were a wonderful staff, but we had to get strict in that point. But I learned a couple of things here and there that were very worthwhile to incorporate in my own practice.
I am just shaking my head over here, because I think of how many administrators did I try to explain that to, where the first visit is at 8, but they're not even roomed until 8:15, and maybe by then their vitals are done. So how am I supposed to see a patient at 8? So exactly. I totally hear you and I feel you. And I know that there are multiple people listening to you share what you did, and they're probably shaking their heads too. So crazy times that we have lived in fee for service, and patients and doctors continue to live in that world. Now, you mentioned that you offer multiple services in addition to primary care. So when you mentioned the services like FAA physicals and weight management and aesthetics, did you buy equipment as part of your opening budget for those different services, or did you add on equipment as you added on services?
So it was the latter. I added on equipment as I expanded my services. And for the FAA, basically, there could only be a certain number of AMEs. That's what they call the medical examiners per geographical location. And so you have to apply for it. Then you have to take some pre-courses, and then you have to attend the actual training, which is a week long in Oklahoma City. And then you take a test. And then after that, then you're certified. So initially I can't do class 1s. I can only do class 2 and class 3, but the goal is eventually to be certified to do all classes. For the aesthetics, I spent a lot of money on training. So it wasn't like I spent, one course and said, okay, let's go do Botox, because these classes are about $3,500. Well, back then, that's what it was. But no, I've spent more, close to about, I think it's the last time I tried to add things up, it was about 65 to 70,000 in training for aesthetics. And I think it's worth it, because I want to be able to provide these services and also say that I trained with, key opinion leaders. And I try to keep always up with that, even though I don't do so much aesthetics, but I do some.
I appreciate your transparency when it comes to the investments that you've made. I want to ask there, in terms of investments, when you are deciding to add another service or go to a training to provide another service or buy equipment to provide a service in your clinic, how do you evaluate financially which service are you going to provide next? And how do you then budget for that service?
I wish I can tell you I had this eloquent, very detailed, pragmatic thing. I just go with my gut feeling on things. And a lot of people don't operate like that, right? But for instance, I knew I wanted to do weight management, and I could have gotten myself a scale that cost me $500, but I had to go with the one that cost me, I think it was $12,000 at that time. I haven't made my money back because for my members, it's free to get on the InBody 570. But for people that are just, especially the people in the fitness industry, want to come in and do their body composition, I charge $25. Have I made my $12,000 back? Absolutely not. But that is a tool that I need so that I can provide, weight management services to my patients. Basically, you invest in things that you feel like you can give good value and justify, the price that you're charging. It's not all about, I'll be the cheapest, I'll be the best doctor, because some people are hesitant, like, you're doctoring, you're that cheap for, primary care. So there's a lot of, controversy on like what you should charge, but I think you should also know your worth and the amount of investment that you are putting into your business to offer your patients.
And when it comes to offering patient care through memberships versus one-off services, what's your opinion on how to balance the two? Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
So initially, I was doing DPC, and I couldn't get people to convert to doing DPC. So I was doing a lot of one-time visits, and people would pay $150 like nothing. But then my DPC membership just wasn't growing. And I think a big piece of advice that I received from Dr. Casey Rossabell, when I called her, she said, you're shooting yourself on the foot. You need to stop doing this one-time visits, because then no one's ever going to see the value in the membership. So once I stopped doing those one-time visits, and I think at that time I only had like maybe 30 patients, is when I started to definitely grow. Because if you like the way I treated you, if you like that relationship, if you like that rapport we established, then you would consider doing the membership. And some people don't want to justify, well, why should I keep, paying for this membership if I'm only going to see you once every 2 or 3 months? And I tell them, because when you need me, I am there. And I'm going to give you very, very good care. And the care that you receive with me is very proactive, and it's not reactive. And so then I tell people, you know what? You will put priority on things that you feel like are important. And to some people, it's their nails, it's jewelry, it's their vehicle, it's shoes, right? And if you see that your health is a priority, then you'll invest in it.
So true. And I'm sure you feel this with your patients who have remained members of your practice, is that the appreciation of your services and your value proposition and you as a doctor is very different. Like the way that they talk about you in word of mouth, when they share about your clinic and that word of mouth marketing that you talked about, it's very different than somebody who might talk about your services as a one-off primary care visit and is talking about like how cheap things are. So it's a good point to make. What about your services that you offer as one-off services for non-primary care type services?
So that would be the aesthetics, and that would be basically just fillers and Botox and facials and microneedling, and then the hormone replacement therapy, which is separate. In the aesthetics, I also do PDO threads. And my goal is to eventually become DOT certified and certified to also do fireman physicals and maybe aircraft physicals. I've had some patients, for instance, when they're for hormone replacement therapy and I see that their blood pressure is that high, really high, I go, well, I can't prescribe you new hormones because it's going to make your blood pressure even higher. Well, my doctor, I can't see my doctor for the next month or 2 months. I was like, well, when you get your doctor in 1 or 2 months to give you a visit, then you get that controlled and come back to me. And sometimes people are like, you know what, I don't want the hassle. Can I just join? And so they have joined. Or even patients that are getting their, Botox, something as simple as, oh, I have acne and I usually get prescribed XYZ. Can you do that for me? And I go, I could if I were your primary care doctor, but I'm not. And so then they join. So that's been really nice. And what's been fantastic is that, especially with my DPC patients, they know me so well that they trust me. And sometimes they tell me, what do you think of me doing XYZ? I'm like, well, that would sound great, but first we got to get your A1C under control, right? So then there's a lot of crossing over, I guess you could say, between patients. For the patients they're not considered my patients, but they're FAA physicals, I let them know that this is not a patient-doctor relationship, that I'm just doing a regulatory physical exam to make sure they are safe to fly in aircraft.
Can you speak to that? Even though you're not doing chronic care management for patients who are getting aesthetic procedures or hormone replacement, that you are having them still come back for repeat services because you're doing services that are not set it and forget it type of procedures?
So that usually applies to the aesthetic procedures. I tell my patients, the ones that want to come in, let's say for lip filler, they're like, oh, I want to look like this. And I'm like, well, your lips are really thin. It's going to take a while. So we have to first build on that. So we first do maybe half a syringe or even a syringe. And then a month later, have them come back and they're satisfied with the results. And I tell them, I am not going to you're my canvas. And so I'm not going to have you looking like a duck with those duck lips. And people are going to say, who did that? And you're going to say, it's Dr. Medina. I don't think so. So let's take things slowly. I need you to trust me. And then we'll take it step by step. And a lot of the times, more than 90% of the times, they come back. They come back because they like that service and they're like, well, let's do something else. And I'm like, okay, well, then let's do it. And so, so my goal eventually is to bring in a laser or two so that I can have the complete aesthetic treatment that I can offer them, different services.
And another unique thing about your practice is that you offer exclusively virtual only DPC memberships. So can you tell us about how you created that offering at your practice and how has that been working for you?
So it's not something that I initially started with. Again, it was because of social media. I had people from different states reaching out to me and just asking me questions. And a lot of times it's through DMs. And I tell them I don't give medical advice through DMs, but they were just asking me if it's something that you treat. And I'm like, yes. Oh, I've been following you for a long time and I feel like I know you. And I'm like, okay, great. Thank you. Can you be my doctor? And I just have to tell them, unfortunately, I'm not licensed in your state, but I'm definitely licensed in Texas. And I kept seeing more requests for that. And I said, okay, let's give it a try. And so basically it just started within the last couple months of 2022. And so it's been going great. And I love it. And I tell them that there's limitations to virtual visits and that there will be a time when I'm going to have to go into a facility, whether it's an urgent care or an ER, because it's not something that I can take care of virtually. And they understand that. And then that's it. We proceed. I do chronic medical condition management. I can still do preventative services. I can still do labs. So all that is great and natty.
Earlier, you mentioned how you learned a very important thing from your previous job in terms of being close to the front versus being farther from the front where patients come in. You have Jacqueline and Rosario working with you on your team. How did they come to join the practice? And how do you guys function as a team because of your experience at your former office and urgent care and other places you've worked?
So I think having a good team will make you very successful. And so I didn't want to hire randomly. And I was very particular because I had so many people try to send me resumes. Can you hire me? I'll work for free. I'll do this. I'll do that. But even if the work was for free, I wanted to make sure that it was the right fit. But it never happened. And so I ended up meeting Jacqueline through her brother. Her brother, Abraham, rotated when he was a student undergrad at my clinic, my former clinic that I was employed at. And interestingly enough, I took care of his grandpa, and I loved his grandpa, and he loved me a lot. And Abraham ended up not going to medical school, and now he's actually he got his MBA, and he's working for one of that same ACO I was a patient at. And so his sister, Jacqueline, was still a student at A&M, Texas A&M. And so he was like, hey, can I give my information to your sister? And I said, to my sister, I said, absolutely. Then I met her and she was wonderful. So over the summer, she was very trying to learn. She would go the extra mile, and patients really liked her. And so she just was worried that she was going to graduate college and that she didn't have any opportunities to rotate because of COVID. And I told her, well, you can rotate here. I mean, if you like it. I said, do you want to work for me? And she was like, yes, absolutely. So she's been my right hand. And that's what I tell her that she is, because that's what she is, my right hand. So she helps me doing, assisting me in procedures. I've taught her phlebotomy. I've taught her how to do IM injections, and things like that. And so the goal is for her to go to medical school as well. And she has fallen in love with direct primary care. And she tells me she wants to be a family medicine physician, which is one of the biggest compliments ever. So we use Spruce in my clinic. It's a really good app. It's a voice over IP where my patients can call in through Spruce, and I am able to assign tasks to my team. And so we're always on the same page. And so, for instance, I write Mr. X needs labs in 3 months. So I forward schedule a message for the date in 3 months, and I tag somebody on the team. Rosario is a wonderful, wonderful, wonderful woman with a lot of patience, and I love her so much. She's actually my mother. She is my biggest cheerleader. And so what's really cool is a lot of patients don't know that, right? But they see how she does her job with so much love that I've had patients ask me, is she related to you? And I go, yeah, she's my mama. And so that's pretty cool. I've had patients bring cookies or bring things for her. And I'm like, well, she's not here. She's in New Mexico, but it's pretty cool. And so she has a fun time because she's no longer, she was a phlebotomist for 20 plus years, and she's not doing that because when COVID started, she just felt like it was safer for her to stay home because of her medical conditions. And she was absolutely going crazy, not being able to do anything. And so she said, I can help you, because after my sister went to medical school, I was going crazy, just answering the phone, seeing the patients, triaging the patients. And so what I learned, which I should have learned a long time ago, is that you have to learn how to delegate your work so that I can be the physician, right? And there's nothing wrong with answering your own phones. There's nothing wrong with drawing your own labs, but it will halt your growth. And so by delegating certain things, whether it's to Jacqueline or to Rosario, I've learned that, for one, I can trust them. I don't micromanage them, but we've become such a good team. We're so efficient at the things that we do. And so you have to trust the people that you're going to hire, you're going to work with.
When you are describing you wore all the hats, was there a time when there were no staff in the office?
Mm-hmm.
Gotcha. And then once you started bringing staff into the office, whether that be Jacqueline or, a temporary person that you were interviewing before her, how did you go from being in an office where you were the only staff member present to bringing other people on when it comes to OSHA compliance?
Well, I did OSHA training, and I had both Rosario and Jacqueline do HIPAA and OSHA training. And I think I got that through the Sharps people that I use for disposing my biohazards. They offered that. Actually, I think Jacqueline did hers through A&M because she did it free. And so that's how that got done.
You mentioned Spruce earlier, so I want to ask you about the other tech that you use for your clinic. How did you decide on things like your EMR and other pieces of tech that you use to run your practice every day?
Perfect. So before I had about 8 different systems. And when I didn't have a lot of patients, I was like, this is manageable. So I would use Sign Now to get patient intake. I would use Spruce. I would use the EMR, which is One Touch, was a free EMR. And it was okay for what it was worth. But then I had no way to do like the practice management side, like who paid what. And so their practice management software was $225. And I was like, by the end of like one patient visit, I would have to download things from Sign Now portal into the EMR. And it was just taking so much work. And I spoke to Rebecca Behrens and she was like, what are you doing? I'm like, I don't know. I don't know what I'm doing. And so she goes, why don't you use an EMR that is more, DPC friendly? And I'm like, well, what is more DPC friendly than a free EMR? And so she was like, okay, so she used another EMR and she used Hint. So I used Serbo and Hint, which meant that I no longer had to pay for that software, which is $225, which also meant that I didn't have to use Sign Now for the intake because it's all integrated through Serbo. So by just having that small conversation with Rebecca, Dr. Behrens, she gave me a lot of insight of what could be done and just do things that more like automated. I would run the memberships through my point of sale system, which is Clover. But the issue that I was having is when a patient went from age 18 to 19, it wouldn't catch that. So it was just too much for me to handle. And I said, okay, we have to clean house here. And so basically I just used Spruce, Hint, and Serbo. And the reason I love Serbo so much is because when I left that EMR, even though it was free and I no longer paid for the $225 a month for the management service, they wanted to charge $5,000 to import all my patient data and allow Serbo to import that into the new Serbo EMR. And Ben, which I later found out was the owner of Serbo, was like, that is ridiculous. We're not doing that. And he found a way around it and imported everything without any issues. So initially, everything had imported fine, except for the labs, which is one of the most important things, because you need your labs to see, how these chronic medical conditions are trending. And Ben was awesome and he took care of that. And so I love Serbo. I like how customizable it is and I wouldn't change it.
Awesome. And you dropped a great point that people should ask about when they are choosing an EMR or when they're interviewing EMRs. If you decide to change EMRs in the future, what are the pros and cons about doing that per EMR, the system that you're looking at? So thank you for mentioning that. In terms of tech, this is not necessarily a SaaS question, but when it comes to the tech that your patients interact with, I love your website and I want to highlight the fact that it comes in both English and Spanish, because you mentioned that the company that you had hired for marketing did your website, did the blogs, but it seemed like a robot was involved. Did you have your website in Spanish and English from the beginning, or was that something that developed based on your patient population?
So that's something that develops later. And my website got done a total of 3 times. Okay. So the first time with that expensive company, the second time with a local guy, which did a good job, but I don't think he understood what DPC was. And it looked pretty. The website looked great, but I was like, this is not me. And then the third time I actually used Alexa Salas, and she did a good job. She also used Wix, and I learned, because of YouTube, you can learn all kinds of things, and I had the time. And so she did like the basic layout and, exactly what I told her. I gave her the content. And then I translated it in Spanish, and she did that as well. So she basically copied the website in Spanish as well. And anything that I need to modify, so I added the FAA portion. I added, I think it was the PDO portion. I learned, and you just learn and you do it on your own. And so I like that I went with Wix. I've had some people reach out to me saying, oh, the SEO is not that good. It's all pretty, but it's not that good. At this point, I don't care, because for me, what's been working, like I said, has been word of mouth. And the SEO is good, but I mean, it's okay. I know it's important, but it's not everything, how a lot of people put all their weight on that.
And when it comes to the term direct primary care in particular, when you translate that into Spanish, is there any confusion about the direct translation of direct primary care, or how do you go about describing direct primary care as a model for those people who might not speak English as their first language?
Well, Spanish, even though I was born in New Jersey, Spanish is my first language. So I think in Spanish. And so explaining it to them is not very hard for me. And so the thing is, I also wanted to reach out to, Latinos and minorities in the community because they're the ones that usually have least access to care. And so I had to make sure that if I wanted to reach that population, my website had to be not only that they can digest the information, but also had to be also available in Spanish. And so that's very important. And actually, you just reminded me, one of my goals for this year is to make more reels, but also in Spanish, to let people know that, I do speak Spanish.
Because Spanish was your first language and because you are talking with people who Spanish is also their first language and possibly their primary language, do you have any tips on physicians who are looking to create a bilingual or multilingual website in terms of copy or in terms of strategy?
The story of my logo, when my aunt told me that it was in Spanish, and I translated it to English about, I swam in the waters and it's not time for me to drown at the shore. It was first in Spanish and I had a hard time translating it to English. But the thing is, you have to make sure that you don't just use something like Google Translate, because if you just do that, it's not going to sound phonetically correct, right? And I also had people go over my website that are better at, even though Spanish is my first language, I may not have very good written skills in Spanish. So I've had my friends, I have a friend who's a teacher and she only teaches in Spanish. I had her go over it. I had my parents go over it, and just to make sure that it makes sense to the person that's reading it. And it was very important because I've had people that don't speak English come to my clinic, and the translator would be a family member, and I would ask them questions. The family member would ask them, and the patient would give him like a 2-minute explanation, and then the translator would say, "She's fine." And I'm like, "Look, I don't speak your language, but after 2 minutes of her rambling, I know she didn't just say she's fine." So I had to make sure that at least for the Spanish speaking community, that they feel comfortable enough that they don't have to bring somebody into the room with them so they can explain exactly how they're feeling.
Gotcha. And with Houston being such a huge area, as you've explained, what have you done for translation services if you need help with understanding a patient?
Well, thankfully, that's only happened one time, and the patient was from Croatia. And I just told the son who brought his mom, I need you to be present because otherwise I won't be able to communicate with your mom. And so he was always there at the visits. She ended up moving back to Croatia, but she would tell me, "I can't wait to learn English. It can just be me and you talking." And I'm like, "Yeah, totally. That would be great."
So now that you have been open for quite some time, you've pivoted, you've learned, you've continued on. I want to ask about DPC doctors reaching out to you. When DPC doctors reach out to you, when they're thinking about DPC, when they're doing DPC, like how you even said, Jacqueline is thinking about DPC, what are the main things that you suggest a person start with or start researching, given your experience in your clinic?
I tell these people that I'm trying to pay it forward, and I want to be kind of like how the mentors of the DPC, movement were to me. I want to be that to them. But what I can't do is I cannot spoon feed you things. So I have to see that there's effort on this physician's part. So not like, "What do you think I should do?" Or "How do I do this?" I mean, there's so many books on this, so I try not to be snarky, but I said, "Look, if you want me to help you, I need you to first do some homework and please read this book and this book. And when you're done, you can holler at me and we can discuss it." Because there has to be effort on this person's part. I can't just sit here and give you my free, valuable time and you're just not putting any effort on your behalf.
And along that same line of questioning, the last time I saw you in person was at the mastermind that Dr. Claude Ryan and Dr. Leah Gupta had hosted in the Chicagoland area this last summer. So I want to ask, what was the reason that you decided to go to a mastermind?
Well, because I had growing pains and because I was stuck at a number and I didn't know what else to do. I felt like I had gotten very creative in terms of my marketing. I've done everything from, the expensive marketing company to publishing in magazines, local magazines that everyone throws away, nobody reads, to, going door to door. And it just so many things. And I'm like, okay, there has to be something that I'm missing here. Like there has to be Like, what am I doing wrong? And so that's why I decided to go to the mastermind. And I got so much valuable information from it. And one of the funny things that I mentioned at the mastermind was that one of the things that I did to market also, I went to a strip club. And I took money out. I told my husband, today, let's look nice. We're going to a strip club. And he's like, why? I said, we're going to market over there. And he's like, have you lost your mind? I said, no, I haven't. Those women have disposable income. They got to look good, right? So let's just go. And I went and, got my husband a lap dance, got me a lap dance. Everything was great. And I give out my card and 2 people showed up, which is a little less than I had expected, but whatever, it worked. So you just have to think outside the box to make things work for you. You don't have to do everything the way it's been done in the past.
What other big lessons or takeaways did you get from that mastermind?
I had a whole thing of notes. I can't remember off the top of my head right now, but how to fire a patient, how not to barter, because that can get you in deep waters. And Dr. Ryan told me that. And I've had patients try to offer me, I'll give you some, baked goods because I have a sweet tooth. If you can just, waive my re-enrollment fee. I can't do that. I just can't. And so had it been another time, I would have said, sure, let's do it. But I'm just sticking to my boundaries. I've learned to say no. And no feels so amazing that I don't have to please everybody. And that's just the way it's been.
It reminds me of something that somebody had posted where no is an answer. No is a full sentence. So it's definitely something that I think that as you go on, you definitely feel more comfortable using no as a sentence. And if not, I think that if someone is not, I think that's a good reason to go to a mastermind. You mentioned firing patients and lessons learned there. What did you learn specifically?
So what I didn't do before was when a patient would come in is I would never see if their account is up to date because I would figure, of course, they're good people. They're going to pay me. But I got tired of chasing people down for payment and it just got old. And so then I spoke to my attorney and I go, what happens if I don't fire them? Because they haven't paid me. And his words were like, you're not a charity clinic. At the end of the day, you're a business. And what's going to happen is you still have the duty to that patient, even though that patient hasn't paid. So your best bet is to fire them, give them some grace, right? To give their account up to date and then just dismiss them from the practice, because that way you don't have any legal obligations other than the 30-day emergent care to them. So that's something that I've learned.
I want to change the subject a little bit. I mentioned how you are such a trooper for doing this interview because you have a newborn at home. How are you adjusting to life with a newborn and being a DPC physician?
So luckily for me, my patients are also cheering for me. They were very excited. They were very invested into this pregnancy just because I thought I was done having kids and apparently not so, right? And so they saw me grow. They just saw me throughout every phase, right? And I told them initially that I was going to have coverage, and I had thought that my brother was going to, cover for me. My brother's an ER physician, but he never took the JP exam for Texas. And he's like, I don't have time for that. And so then we had to go to Plan B. And Plan B is basically me, right? So the clinic is still open. Jacqueline can still do take photos and just weigh-ins on the in-body when the patients are due for their monthly photos or whatnot. And I can still refill their medications. I did tell them, let's limit, the phone calls and the video visits because I'm recovering, right? I had a C-section, 10 days ago? No, 10 days ago. But I tell them that I'm still available to them. And so if I had this one lady with a really bad sinus infection. Don't tell me the diagnosis because I do that, but tell me, write me a book. And this lady literally wrote me a book. That portal message was so long. I was like, oh my God, I need a coffee break. Sure enough, she had a sinus infection. I gave her antibiotics. So my patients, for the most part, have been very understanding. I've had a couple that have been not so much understanding, oh my God, I need a refill. Okay, we'll refer to the patient guidelines because refills can take up to a week. And again, I had built that habit that once they submit that refill request, I would refill it right then and there. Well, this is one of those times where this is backfiring on me because I'm not refilling it that same day, right? I've had this baby 10 days ago. And so I've been telling Jeff and remind these people to go back and read the clinic guidelines that they agree to, because right now the most important thing is my baby. My baby is the most important thing right now, and me being okay. And I tell that to my patients. If y'all want me to take care of you, I need to be okay up here. Like, I have to be of sound mind and spirit so I can give you the best care. And when you pose it like that, they understand. And there's some days that I'm overwhelmed with life. And there's some days that I'm like, you know what? I need to take a day off. I'm not coming into the office, and just letting them know that I'm just as human as they are. And I go through the same struggles as a parent, as a mother, as a wife, like they do. They're so empathetic of the situation. So I'm very grateful that the patients that I have value me as a person, right? And as a physician. And yeah, it's been great.
I can't wait to see you at the DPC Summit this year.
Yay, we're going to party. So fun fact, I was actually pregnant at the DPC Summit last year, and I didn't know that. But there I was living my best life because I had no kids, no husband. I didn't have to drive nowhere, and I just had fun. I'm looking forward to reconnecting with people. I'm looking forward to seeing some of my, really good friends, including you there, and just keeping you up to date of what's been going on. I have a lot of career goals that I want to accomplish, but I'm going to leave that off till next time, until I get there and I can say, hey, I did it.
Well, again, I and the listeners greatly appreciate you taking the time out of your schedule with a newborn to share your story. And thank you again so much for doing this. And I want to close with asking, do you have any last words to share with the audience?
All I can tell everyone is to keep showing up for yourself. There's sometimes that, things get rough, and just rely on your tribe. And keep in mind that everyone thinks that just being a DPC doctor is this glamorous thing, right? Because you're your own boss. But there's a lot of ups and downs that occur. But you have this vision. I told my husband, I will never, ever, ever go back to the traditional service. So this is going to work, and I'm going to make it work. And so that's why I'm telling you guys to just not give up, rely on your mentors, on your friends, and you can practice medicine happily. I love that Dr. Deepti's name is My Happy Doctor, because I can kid you not, I'm the second happiest doctor. She's number one because she claimed it, but I promise you I'm number two. And everyone knows that. And it just shows, it just shines, right? The way I do things with my patients, because I am embracing my freedom, and I'm doing that with DPC.
Next week, look forward to hearing from Dr. Ari Chung of Lotus Health and Wellness in Mishawaka, Indiana. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now, as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.